People are at a point where they're in a crisis and their actions and behaviors have been compromised to what most of society would consider normal behavior.
Officer Eric Gunnels is a crisis intervention team officer at the Phoenix Police Department. His squad, and others like it, respond exclusively to calls involving behavioral health.
Mental health pickup orders. We also encompass a lot of check welfares. Danger to herself because she stated she wanted to overdose on drugs.
Many of these calls come directly from behavioral health clinics, asking for help transporting their patients.
Her clinical team is amending her to be brought in for an evaluation.
The only reason we're here is because your clinic is worried about you.
It's part of a coordinated effort in the city of Phoenix to get the right kind of help to those who need it, which frequently means cutting law enforcement out of the equation completely.
We would like to divert people from the 911 system, like from that criminal justice framework, back into a behavioral health framework as soon as it's safe.
Detective Sabrina Taylor is an internationally recognized CIT trainer. She's also the CIT coordinator at Phoenix PD.
This is an all-hands-on-deck approach, and that's hard. But we are so fortunate to have really great community partners.
Partners like the Community Assistance Program, which now responds 24/7 citywide, sending caseworkers to calls when necessary.
911, where's your emergency?
All Phoenix 911 operators are trained to recognize when a targeted mental health approach is best, routinely directing calls to the 988 Suicide and Crisis Helpline, and even to a handful of clinical partners who work with CIT officers daily.
Come in, we arrange things, we'll get you to a place that you are comfortable going.
And while most experts agree law enforcement is not always the best option, sometimes it's just a matter of safety.
They could be lashing out whether they want to have self-harm or they're lashing out wanting to harm others. Law enforcement, we do have the tools that can keep us and others safe.
So it's vital to have as many officers trained in behavioral health response as possible.
This is Dustin with the Phoenix Police Department. Can you open the door, please?
The Crisis Intervention Team runs a 40-hour training for CIT certification, using crisis actors to mimic real-world scenarios.
There's so many different departments here, there are federal agencies here, and everybody kind of working together and learning together because, out there in the world, when something major happens, when a major crisis happens, you might have DPS and MCSO and Phoenix all responding to the same scene.
These CIT trained officers are spread out across most shifts in every precinct in the city.
I think it speaks volumes when you're able to kind of relate and understand what they're going through and kind of help them get the resources they need to kind of continue on with life.
CIT is just one of several scenario-based trainings offered at Phoenix PD.
Do me a favor, just toss the knife, okay?
What's got you struggling?
Integrating Communications Assessment and Tactics, or ICAT, is now a mandatory full-day course at the direction of Interim Chief Sullivan.
Scenario-based training is critically important because it puts officers in the actual situations that they are going to face on the streets.
So as the world becomes increasingly complex, Phoenix PD is evolving its response.
Did this job because I wanted to help people, and I still do. And if spending a few minutes having a conversation about some very difficult and hard things, if that changes maybe that moment and maybe down the road their life in a positive way, I'll take that.